You're listening to The Physician's Mind, raw stories and real talks from people striving for greatness in medicine and in life. This is where ambition meets action and where the relentless come to level up. I'm your host, Curtis Wilkerson. Thank you so much for listening. Let's get right into it. Dr. Brett Cordes is a former ENT surgeon whose battle with cancer at age 19 and recovery from opiate addiction has reshaped his life. Today, he's a life coach helping physicians find purpose, resilience, and balance. If you enjoyed this episode, please share with your friends on Spotify, Apple Podcasts, or YouTube, and follow us on Instagram at The Physician's Mind. You can reach Dr. Brett Cordes at www.theburnoutdoc.com. Hope you enjoyed this episode, and thanks for tuning in. Hello, everybody, and welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson, and today I'm honored to be speaking with Dr. Brett Cordes. Dr. Cordes, how are you doing today, sir?
I'm doing well, Curtis. Thanks for having me.
Absolutely. Happy to be chatting with you today. So first off, you had a stellar academic and clinical path. You were summa cum laude at LSU, AOA in medical school, and you had awards for both research and teaching during your residency. What was it that originally motivated you to pursue medicine with such intensity and ambition?
Well, I appreciate the question. I'll give you a very short answer, and then I can speak as long as you want me to about it. But basically, in short, I was finishing up my freshman year of college at LSU, and my major was history because I had absolutely no idea what I wanted to do with my life. My father was a mathematics professor at LSU at the time. And my mom was retired, but she had been an English instructor for over 30 years, also at the college level. So academics was heavily prioritized in my family. My sister was an attorney. By this time, she was already working up in New York. But I had no idea what I wanted to do. I liked history, so I chose that as a major. We didn't have any healthcare providers, no doctors, no nurses, nobody in the medical field in my family, in my nuclear family or in my extended family. So I really had nothing other than watching the show ER. I really had no exposure to anything medical. But I was diagnosed with non-Hodgkin's lymphoma in April of my freshman year of college, right as I was about to take final exams. And unfortunately, it recurred after my initial 4.5-month chemo treatment. So in all, I had 16 months of treatment for this lymphoma. And ultimately, it culminated in a stem cell transplant in January of 97 at MD Anderson. But in short, my exposure to the medical field as a patient, and not only as a patient, but as a cancer patient over those 16 months is what inspired me to go to medical school.
Absolutely. So if that was the short version of the story, I can imagine that the long version is very interesting. So I'd be happy to hear more of what your thoughts are on this topic.
Yeah, well, I did. I actually wrote a memoir and had that published. I wrote it originally as I was finishing up my treatment in, I guess this would have been in July of 1997. And I wrote this memoir because as I was undergoing treatment, there's all kind of cancer books out there. And at the time in 97, there weren't a lot of memoirs, and there certainly weren't a lot of teenage perspectives. And so my goal was to write about my own experience as a teenager, which I did. And then as medical school started, I kind of forgot about it, to be honest with you. Once you start medical school, you'll no doubt find out there's not a lot of room for anything else. But 20 years after I wrote this memoir, I decided I was going to finish it up. And so I kind of had a part 2 to it, but I kept my original writing as it was written as my 19-year-old self. And so my cancer journey, I like to call it a journey and not a battle, but my cancer journey has really shaped my life. I mean, there's no doubt about it. I would have never been a physician if it weren't for that. But lots of silver linings, lots of life lessons that I learned during the course of that. But anyway, the long version is really just more specifics about what it's like to be a cancer patient at 19. When I was diagnosed, I was the typical invincible feeling, untouchable, slightly cocky 19-year-old. And I grew up a lot over those 16 months. I really felt like I lost some of my childhood or at least the young, crazy years of a college student during that, because at the end I had matured a lot in a good way, So to answer your question, your original question, when I started medical school, I was dealing with a fair amount of survivor's guilt. And so I wanted to make sure that I was the absolute best student that I could be, so that I could be the best resident that I could be, so that I could be the best physician that I could be. And so, doing well in school, getting good grades, that was a high priority. And from day one, my goal was just to do my best. And so that's what drove me.
Wow. Yeah, it's incredible how you were able to turn such a traumatic situation into something so positive.
Yeah. And as we will probably get into later in this interview, I was exposed to opiates for the first time during my cancer journey. So, lymphoma, for me at least, lymphoma was not a painful diagnosis. It wasn't a painful cancer. However, I did have several bone marrow biopsies, which are, fairly unpleasant. So I had been prescribed hydrocodone on a number of occasions. And, when I would take one of these opiate pills, it was nice. I wrote in my memoir, it was like drinking a couple of beers. It was like a light beer buzz, but without any of the negatives. And it was nice. I enjoyed it, but it wasn't earth shattering. It wasn't anything to write home about. And so if I wasn't in pain, it never occurred to me to take a pain pill. And so that's really pertinent, because later in my story, when I used opiates for the second time, it was quite a different experience.
Yeah. Yeah, and we're absolutely going to touch on that. But let's go back to your thriving ENT practice that you had built in Texas. You were teaching residents, you were working hard. What were those early years like for you? And were you recognizing some signs of early burnout, or did it all feel like success at the time? Run us through that experience.
Yeah. And so I'll back up a little bit in residency. So, because this is also important in my story. By the time I got to the end of medical school and in segueing into residency, during med school, I thought I wanted to be an emergency room physician. Like I said, the show ER was really my only exposure to medicine. And so in my first year of medical school, you had the option of joining the honors program, which was a 4-year research program. And then, of course, you had to keep your grades up. And so I chose a project in emergency medicine. It was in hyperbaric oxygen therapy. But I worked with the chairman of the emergency department because ER was my goal. And then roughly 1 week into my 3rd year surgery rotation, it was pretty obvious that I was going to be a surgeon. And for any medical students out there, for me, it was the personalities of the residents and the fact that they meshed with mine was what attracted me to surgery. And so for a lot of people who are worrying about, I don't know what I'm going to pick. I don't know, what field I want. Look for personalities that are similar to yours, and that'll oftentimes lead you in the right direction. But ENT is a competitive field. So I knew I had to do really well in school. And so what happened gradually is my goal shifted from doing my best to being the best, which is perhaps a subtle difference semantically, but it's a major difference in real life because I never felt like I was prepared. I almost got obsessed with, doing well in school. And so when I segued into residency, my goal was to be the best. I wanted to do the best on the in-service exam. I wanted to be the best surgeon. I wanted to be the best teaching resident. And so it's important for the listeners to know, again, because it goes into my addiction later, that I liked the external validation. I liked hearing you did a good job. I liked the accolades. I liked the achievement. I liked the awards. And so that was what was driving me by the time I got into residency. But I really enjoyed residency. I worked hard, but again, ENT is not general surgery. It's not ortho or neurosurgery. I'm not working 80, 90 hours a week in residency. So I enjoyed it. I got along really, really well with my resident mates. Or my class of residents got to be pretty tight. We went to each other's, birthday parties and children's birthday parties and whatnot. So I had a good time in residency. And I started with a private practice group within the Texas Medical Center right out of residency. And I absolutely loved it. I tell you, those first those first 3 or 4 years was, I mean, I get tired of hearing the term I was living the dream, but I mean, I really was living what I thought was a perfect life. And I loved work. My wife and I had 2 healthy children that she was taking care of at home. You know, everything was great on the home front. And I built my practice up very, very quickly, mostly because my partners were extremely good to me. And so I was able to see all their leftover patients. So any walk-ins that called in, I would see. A lot of their post-ops I would see. And if they were behind in clinic, the front desk would tell the patients, hey, we have a new doctor. If you don't want to wait, you can see Dr. Cordes. And so I was able to build my practice up rapidly because of that. And so it only took about 9 months of working until I got to 100% capacity seeing patients. Now, the surgeries lagged a bit. You know, it was a couple of years before my surgery case log got up to where it needed to be. But in terms of seeing patients in the office, it built up quickly and it was a lot of fun. I love being in clinic. I mean, I know that's something you don't usually hear from a surgeon, but I like meeting and developing relationships with patients. It's, you know, patients come in, you remember them from last time. If you're listening, you know, you ask them, hey, how did your nephew do in that baseball tournament or whatnot? It makes the work more enjoyable to treat patients on a personal level. And so it was fantastic. And then as an added bonus, I did have the self-awareness during residency to choose private practice as opposed to academics. Because with my personality and the way that external validation was driving me, at that time, I was getting sick of the competitive environment. I was getting sick of doing things that I didn't want to do just because they looked good. And so I wasn't really interested in research. I certainly wasn't interested in basic science research. I didn't like writing papers. And so I didn't want to get into a situation where I was thriving clinically, but then I had this whole research side that I had to do. But it was a sacrifice because teaching residents, training residents, I was passionate about. All through residency, I absolutely loved teaching and mentoring the junior residents. And so choosing private practice, that was going to be a sacrifice. But the way that things worked out, within 6 months of graduating residency, both Baylor and the University of Texas at Galveston, both of the ENT departments decided that they would send a resident to work with our group. Because when I added to the group, we had 5 doctors there. Now we had 2 third-year, I'm sorry, one was a second year and one was a 4th-year resident. So I was able to teach and train and mentor residents, but without doing the research of academics. So it was really the perfect storm.
I have a quick question about how that works, because I was just reading something about a similar scenario, a second, third-year resident joining a private practice. What does that look like when a resident joins the private practice?
So what it looked like for us is the top priority for the residents is to be in the operating room. So if one of the partners was in the operating room, there was always one resident in the operating room. And then the second priority would be to see consults in the hospital, which we had a lot of. And so at any one time, you know, our group might have a census of 4 or 5 patients in the hospital. So the residents would round on the consult patients in the hospital, would pre-op and help us with any cases that we were doing in the operating room. And then if there was time left over, they would come join us in clinic, but generally not. Generally, it was OR consults, although they would help us with procedures in the clinic. And so residents loved the rotation because aside from seeing some earwax consults here and there, it was really bread and butter stuff. It was a lot of operating and the residents really enjoyed it.
Okay. All right. So back to the story, you enjoyed having the opportunity to teach them still, and
and everything was going great. So I was an assistant clinical professor at both Baylor and UTMB, and was able to teach these residents. And so what happened around year 5, after it just started to dawn on me that I felt like I was getting bored. And at this time, we had lost the UTMB resident, so it was just the Baylor resident. And within about a year, we had lost the Baylor resident because Baylor was trying to increase their presence at my hospital, St. Luke's. And so around year 5, we didn't have residents anymore. And I just kind of felt bored. Now, in hindsight, I later learned that what I was really feeling was a lack of fulfillment, which was my first symptom of burnout. come to find out. But in real time, I felt bored. I felt unchallenged. So work, for the first time ever, work started to become something I didn't look forward to every day. It started to be a job, you know. But I was thinking to myself, this is real life. This isn't Disney World. A lot of people don't get up rearing to go every single day for their jobs. Grow up and welcome to the real world, right? So, but there was a feeling of some helplessness and powerlessness and anxiety that I was starting to deal with, which I did not like. And also around year 5 is when the external validation stopped coming in. So the Vata boys that I was so used to getting, the accolades, the awards, I mean, my almost entire self-worth was constructed from external validation, which was a major character defect of mine and something I still struggle with, honestly. But when that stops coming in and your self-worth and self-confidence starts to drop, and then couple that with this boredom that I was feeling, there was an anxiety that started to, rustle up that I didn't enjoy. And so the opiates came in. It was a very, I almost didn't take it, but it was a Friday afternoon and a drug rep came to the office and she was selling and brought samples of a hydrocodone based cough medicine. So, I looked at her, I listened to her spiel. She gave me some free samples. I told her, okay, we'll see how this works. But my first thought was, I know how this stuff feels. This stuff's pretty good. So about a month later, I decided on a Friday afternoon that instead of my couple of Bud Light limes that I usually cracked open on a Friday afternoon by the pool, I figured it'd be a good idea to take one of these cough medicine samples and drink that instead of my 2 beers and just kind of enjoy the evening, because that's what I thought it would feel like. And what it felt like was the most significant and unbelievable euphoria I'd ever felt in my life. It was drastically different than how I remembered it back when I was battling cancer. It wasn't even comparable. And it's interesting because, I've since gotten interested in addiction and the pathophysiology of addiction and, the opiate receptors that some people have and don't have. But it's interesting that, none of that biochemistry changed, obviously, in my body. But from a psychological side, there was some emotions that I was trying to numb. Of course, I didn't know this at the time, but the euphoria that I felt was something I had never felt before. And so that decision began what would become a 5-year, very, very slow descendants into a full-blown prescription opiate addiction. So that's how it started.
Wow. Wow. So as your stress evolved into this hidden opiate addiction, how did that affect your practice? How is that affecting you personally, your family? And obviously that is a line that can easily be crossed. How do you think students and physicians misunderstand addiction?
So when I started using cough medicine samples about 3 times a week. I would use them on Friday afternoons. I would use them on Monday evenings, and then maybe Wednesday or Thursday evenings after surgery. And that went on for about 6 months, 3 times a week. And so it took me 2 years to go from the very first time I tried an opiate to using opiates all day, every day. And by the time I was using them every day, I needed to use them to avoid withdrawal symptoms. And so, once your tolerance builds up and you start staving off withdrawal symptoms and you have to have them to avoid that, obviously, that you're a drug addict at that point. But it was a slow buildup. And so the mental gymnastics that I had to perform to justify my use of these things, so I look back on it and of course I'm ashamed, but I really can't believe how I was able to justify doing that, especially after the 2 years when I was using daily, but I truly believed, and I hope you believe this when I say this, but I truly believed that using opiates made me a better doctor. They made me a better surgeon. They made me a better father, spouse, son, because what opiates did for me is that, yes, they gave me the euphoric relaxation, but for some reason they gave me energy, almost like caffeine. And they also gave me an incredible amount of motivation.
Hmm.
And so again, I have since learned that, that's the dopamine 3, the D3 receptor that is responsible for motivation. So just the way my biochemistry works, opiates hits all that stuff. And so I was more motivated. I had more energy and I was more relaxed. So I felt like I was a better everything on opiates. And that's how I justified my use, even when it began and I was using during the workday. But, people are probably wondering how I acquired these opiates to be able to use them every day. And I would have my patients bring in any leftover pain medication that they had after their pain window was over with during surgery. And it began innocent enough because we would just dispose of it in the sink so they didn't have leftover stuff at their house that, their kids could get into or whatnot. That started out as a legitimate disposal protocol that I came up with, but eventually that became my source of opiates. So that's how I acquired them. But so the cautionary tale at this point in the story is that boredom is an early sign of burnout. And again, it's most probably going to be more of a lack of fulfillment than true boredom, so to speak. But for the listeners out there, if that's what you're dealing with, please recognize that that's an early sign of burnout and adjust accordingly. But if I had just listened to my partners on any of a number of occasions, I could have staved this off because from day one, they encouraged me to take at least 3 weeks of vacation every year. They encouraged me to take off at least one day every week from the office and maybe even a day and a half because they had learned that, if you become a workaholic, eventually it's going to bite you because everyone is going to burn out if that's the case. So, and I didn't listen. So, the only person that I can point the blame to is myself when it comes to burnout and the following addiction that was included in it because my partner certainly tried to stave that off. But for the second part of the question, what was it, what doctors and residents and people have wrong about addiction or misconceptions or?
Yeah, what do they not understand if you think there's a misunderstanding about how easily that line to addiction can be crossed?
Yeah. Well, everyone knows now that addiction is considered a disease. And so, there are a couple of theories about addiction. My personal feeling is that it's kind of a combination of a neuropathological disease in the brain because there are brain changes. But those brain changes don't show up until someone's in active disease, until someone's actively addicted to something. So before they ever become addicted, before they're ever exposed, you don't see those brain changes. So that can't be the sole cause. And then another theory is that it's a result of childhood trauma and the emotional void that is left over from this childhood trauma is filled with the euphoric feeling of the opiate.
Yeah.
And so my opinion is that it's kind of a combination of those two things, right? And also, you've got to be someone whose opiate receptors are upregulated so that when you do take them, you have a euphoric feeling as opposed to itching and vomiting the way some people have. Those people aren't going to become addicted to opiates. So it's somewhat of a perfect storm. But one of the misconceptions that everyone has, certainly including me, about addiction is that in the beginning, the substance of choice was a solution. It didn't start out as a problem. If it started out as a problem, people wouldn't become addicted to something. So it must have worked in the beginning. And what it's working to do is, and again, this is another misconception, it's not providing me with something that I didn't have. It's numbing something that I don't want to experience. And that's the case for most people. So for me, I was trying to numb this emotional helplessness and powerlessness and anxiety, and the opiates did that. And so again, unless you have that void in your emotional life, a lot of people, it's going to be hard to become addicted, and it's going to be hard to become active in the disease of addiction because, again, you've got to have some emotional void that you're trying to fill. And so that would be a misconception that I think some people have. And then, doctors are people, right? So the mental gymnastics and the justification to go from a recreational user to an everyday user is the same as it is for everyone else, which is you'll do what you have to do to get the drug.
Wow. Yeah. And I've heard there's various ways to define addiction, but to my understanding, addiction can be defined as the continued compulsive engagement engagement in a behavior or use of a substance despite the knowledge of negative consequences. Would you say that's an accurate description?
Yes, I would say that's an accurate description. And then from a layman's standpoint, because a lot of people have questions. A lot of drinkers, a lot of heavy drinkers struggle with the question, am I an alcoholic or am I just a heavy drinker? Because there are differences. And believe it or not, for the listeners, there are people who recreationally use heroin and cocaine. Okay, so I've been to rehab two different times. That's something that blew my mind. But they aren't that person's drug of choice. So I say that because you can be a recreational alcohol user. You can even be a recreational heroin or cocaine user and not an addict, because an addict uses substances to change the way they feel, whereas other people, even heavy drinkers, use alcohol to enhance the way they feel. So that's a subtle difference that distinguishes an addict or an alcoholic from a heavy user or drinker.
Interesting. So an addict will use it to change the way they feel, and a heavy user will use it to enhance the way they feel.
Correct.
Yeah, I wasn't aware of that distinction. But Dr. Cordes, you spent years rebuilding your life, your health, your career. What was it like along your journey of recovery? What were some of the most difficult parts of that journey? And looking back now, what are you most proud to have accomplished through that struggle?
Yeah. So when I went to rehab, let me kind of explain what happened. How the house of cards came tumbling down. In short, a patient suspected that his pain medication had been tampered with. And so he contacted the Texas Medical Board, and the DEA got involved, and my partners were alerted. So essentially, I was fired from my job because they found out I was using opiates, and the Texas Medical Board suspended my medical license. And so I was mandated to go to rehab. However, I believed that I needed to go to rehab. I definitely needed to go to rehab. But even at the time, even as an actively addicted person, I accepted the fact that I needed rehab. So went to rehab willingly, and it was a phenomenal experience. I won't say that spending 3 months at a residential facility without television and without telephones during COVID, I won't say that was fun, but it's definitely what I needed, and I really got a lot out of it. It's hard to change yourself without knowing yourself. And so that's what I was able to do in rehab, was to kind of learn why I do the things that I do, learn my character strengths and my character defects so that I can work on those, so that I can rebuild my life in such a way that I don't have that emotional void that the drugs were filling. And so for the addicts, alcoholics out there, it's important to replace your substance of choice with something. You can't just stop using opiates. You've got to stop using opiates and then replace it with mature coping mechanisms and stress management tools and whatnot. So you've got to substitute the use with something. But it was very difficult because it was 4 years that I was completely out of work.
Wow.
Unfortunately, it was during COVID. So my license was supposed to be suspended for a year, and because of inefficiencies and COVID and whatnot, it was suspended for 2.5 years. And so it was 4 years total that I was out of work before I went back to work. And so during those 4 years, you want to talk about a lack of fulfillment, which was problematic for me when I was working. I'm a type A personality, just like most surgeons. It was brutal to not have a job. It was brutal not to have a line of work that I was passionate about, that fulfilled me from a personal standpoint. So recovery is very difficult. Don't get me wrong. Addiction recovery is very difficult. But when I coupled that with the isolation of COVID and tripled that with the lack of fulfillment, it was a tough 4 years. Let's just put it that way. So the most difficult time for me was the isolation. You asked what was difficult about recovery. I would say isolation is the most difficult. But in terms of what I'm most proud of, one thing that I learned in my recovery is kind of a hybrid of the AA program, a 12-step program that addresses the development of a relationship with a higher power. I kind of couple that 12-step program with more traditional cognitive behavioral therapy that I learned in rehab. And so it's kind of a hybrid of the two. But I learned very early on to try to replace the word pride with gratitude. Well, not just replace the word, replace the feeling of pride with the feeling of being of gratitude for this or that. And so that was that was a really, really big thing for me. Just the value of humility itself is really kind of the cornerstone of my recovery. And so, surgeons have big egos. I had a big ego. I don't like to say that I was a cocky young doctor. I was certainly self-confident, and my patients liked me, and I loved my patients. But I definitely had a healthy ego. And so I've since learned to shelf that and to try to truly feel a sense of gratitude for blessings and successes as opposed to pride. But anyway, yeah, it was a long 4 years.
Yeah, I can imagine that'd be very difficult, but I like what you said about not necessarily replacing, but substituting pride for gratitude.
Yeah.
And what did it look like for you when you returned to clinical work? What were you doing in the meantime where you weren't in the clinic? And then what was it like to return?
Yeah. So, what I was doing in the meantime to fill my time is I finished writing my memoir, and I got two other friends who had cancer involved. So finished up and wrote the book and marketed it and published it. So that filled up about a year and a half of my time. And then, my wife and I had some rent houses in Texas. So I began taking over some of that business. We moved to Louisiana in 2021. And so, I'm just like a dog with a bone when it comes to something to do. I just don't do well when I don't have a task at hand, so to speak. So I finally went back to work in March of 2023. We're living in Louisiana at this point. And I joined a group that's based out of Thibodaux. And really the only reason I got this job is because an old fraternity brother of mine was one of the partners there. So, and I continued to be, eternally grateful for that opportunity because he didn't have to give me that job. He did take a risk, hiring an addict in recovery. Let's face it, the risk of relapse is real. It's a reality. And so I'm really grateful that he gave me that opportunity. It was a year contract, and about 6 weeks into it, it was obvious that I had kind of lost my passion for clinical medicine. I liked it. I liked the work. I liked surgery. It was kind of fun rebuilding my surgical skills, and I loved my patients. I still love the relationships that I was able to forge with my patients, but the passion had waned. And that was kind of that was surprising to me because, I was thinking I go back to work and everything is going to be fixed. I'm going to have professional fulfillment again. All my personal relationships are going to improve. I'm going to feel better about myself. And so it was surprising that I didn't fall in love with clinical medicine the way I assumed I would do. And so, is that because the opiate use helped me deal with what was a stressful job that I didn't really think was stressful? I don't know, maybe. That theory has been asked before. I don't know the answer to that question. All I know is that I had lost my passion for clinical medicine. And so the group that I was working for was taken over by a venture capital firm. And so this practice was sold, and after my year contract, they didn't hire me on. And so right around that time, I discovered life coaching as a thing.
Yeah.
And so one of my junior residents and I began chatting on Facebook, messaged each other, and she's a life coach. She's a coach for surgeons. The only thing she does is coach surgeons through burnout, but mostly for leadership skills and imposter syndrome and whatnot. And she was just starting to build her coaching practice. And so, I was commenting on some of her Facebook posts, and she messaged me one day and just asked, she recognized the language that I was using, which is the language of cognitive behavioral therapy. To me, it was recovery language, but come to find out, the CBT involved with addiction recovery is very similar to that of life coaching. And so, she mentioned, hey, you might want to try life coaching. I think you'd be good at it. And one thing led to another. And it's nice to be passionate again about what I'm doing professionally. And so, unlike her, instead of concentrating on surgeons, I'm just concentrating on docs who are struggling with symptoms of burnout.
Incredible. So how do you think your experiences being burnt out, struggling through addiction, offer you a unique lens as a coach?
Yeah, well, one thing that is one reason that the AA program and 12-step programs are so powerful is that there is really an an illogical goodness. There is an illogical power that someone feels when you're telling your vulnerable story to a group of people and all those people can relate. Well, let me just put it this way. I can't put it into words. How comforting that is to be in a room and to be spilling your vulnerability out and not be judged. Not only not be judged, but everyone nodding their head because it's almost like you're telling their story to themselves. And so it's like that with coaching. If I'm coaching someone about burnout, and especially if substance use is involved, I just have a personal history with it that seems to connect with people.
Incredible. Yeah, absolutely. I can imagine that it offers that sense that you've been through it before, so they're much more willing to listen to what you have to say. What are some of the most common themes or patterns that you see in the physicians that you work with?
Yeah, that's a good question. Just kind of, the basic symptoms of burnout. Again, the first one being a lack of fulfillment or boredom.
Mhm.
But then the most common symptoms are grumpy old man syndrome, right? People just because as you become cynical with third parties getting in the way of your doctor-patient relationship, the perception that patients are slowly becoming less and less appreciative as the workload increases, as the bureaucratic tasks increase as a percentage of that work, you just become irritable. And so irritability is, in my opinion, is a common theme amongst every single solitary person that I've ever seen with burnout. I call it the grumpy old man syndrome. Easily frustrated, so people's threshold for frustration seems to drop so that what used to get them frustrated and riled up before, it does it much more quickly now. And especially when this kind of irritability, frustration, anger, this baseline amount of these symptoms and experiences, when that starts to meld into your personal life, you're burned out.
So some of the most common things you see, the boredom, the unfulfillment, the increased focus on the bureaucratic tasks, the cynicism, irritability, and then it begins to permeate into your regular life is sort of a good representation of the structure. So how do you help these guys rediscover meaning in their life and in their work?
Yeah, that's a great question. So, I am just about to finish up my year-long certification training for life coaching. I'm the school that I'm going to is the one run by Martha Beck. But basically, the theory is that our thoughts control our feelings and emotions, and our feelings and emotions control our actions. And so, if we can learn to control our thoughts, we can learn to control our emotions. And emotions really drive everything, right? Um, from a burnout perspective, from a substance use perspective, from a depression perspective, anxiety, if we can train ourselves to change our thoughts such that our thoughts don't result in anxiety, depression, irritability, anger, frustration, then we can think our way out of burnout. We can think our way out of depression. We can think our way out of anxiety. And this is in combination with, traditional psychiatry and psychotherapy, medicines and whatnot. I'm offering this coaching in addition to that stuff as opposed to instead of that stuff. But really as a coach, what I'm trying to do is I'm trying to teach people to fix their own problems as opposed to fixing the problems for them. So again, it's all about addressing certain negative thought patterns that lead to the emotions that these people are trying to avoid.
Yeah, yeah, perception is reality, and it's certainly important to have the internal locus of control rather than attributing your consequences of your actions to some external circumstance. So I want to ask you, you mentioned the importance of controlling your perception and its impact on your emotions. There's a lot of emphasis on burnout, especially among first-year med students, and My thought process on the whole thing is that when you continually tell people to watch out for being burnt out, it can lead to a self-fulfilling prophecy. And by the end of your first year of med school, you're like, well, I am burnt out. But where do you think the line falls between being mentally tough and dealing with some of the inevitable circumstances versus true burnout?
Yeah. So, very short answer to that is joy. So, the thing that distinguishes a very, very, very hard worker from a hard worker who's burned out is that the joy goes away.
Mm.
And you mentioned, from the first year of medical student, it's preached to not burn out, to avoid burnout. I have found that, and I found this through recovery, that for me, it's not very motivating to think of things in terms of avoiding consequences, right? It wasn't helpful for me to lead a successful recovery life with the prime mission avoiding testing positive on the Texas Medical Board's drug test, avoiding the shame of relapse, avoiding the negatives. That wasn't motivating for me. So attaining the positives is what is motivating. And so instead of preaching to residents to avoid burnout, it would help to teach them to find something other than school and medicine and work, find something else that they enjoy and to pursue that. Now, people don't have a lot of extra time, right? Med students don't have a second job at McDonald's or whatever for a reason. They're too busy doing what they should be doing. But I would encourage medical students and residents, especially these younger people, to find anything, a hobby that they enjoy, and to pursue that.
Absolutely. Yeah, that's a good way to put it. Instead of focusing on the negatives and things to avoid, focus on, how would you put it? Focus on the positives, focus on the things you can achieve rather than the things you should avoid. That's good. Yeah, because I would imagine like I said, when you tell someone, make sure you don't get burnt out, that would render it more likely that they're going to experience feelings of burnout, even if it's subconsciously they're primed to be hyper aware for that. So any feeling they may have could multiply into true burnout, perhaps. So that's pretty good to instead focus on what you can achieve, right? Finding things outside of medicine to relax and working your hardest to excel. That's brilliant. So how has your definition of success changed now going from Dr. Cordes to Coach Cordes?
Yeah, that's a great question. I will say that it has changed because, well, happiness has a large part to play in my definition of success now, whereas it didn't before. Before I would define success as being the best at something. I mean, that's really how I would have defined it. Happiness had no part to play in my definition of success 15 years ago, 12 years ago. Now, happiness is the primary theme in my definition of success. And, I have learned that I can find happiness in almost any situation. And really, I kind of was starting to learn this during recovery before I even heard or started training about life coaching. But when you couple that with the knowledge that our thoughts, when you learn to control your emotions, you learn that you can feel happy, you can experience happiness in any circumstance. And so, attaining true happiness is my current definition of success. And who knows, that will probably mature and turn into something else in another 10, 20 years.
Yeah, that's good. Once you learn to control your emotions, you can experience happiness in any circumstance, be it comfortable, uncomfortable, pleasurable, painful. Would you say that it comes with just an acceptance of what is, living with what is?
Yeah. And also learning that negative emotions and negative circumstances are part of life and they're not to be avoided, so to speak. One misconception that people get when they start training life coaching or they start learning about this is that they feel like they deserve to be happy all the time, when in reality, we really, as humans, as animals, we can't experience happiness unless we know what unhappiness feels like.
Yeah.
And so you're going to feel frustrated, anger, disappointment, depression, anxiety. These are negative emotions that it's useful to experience these things because, first of all, a lot of them have value, and we don't deserve to be happy 24/7, but they're not to be dwelled on. And so, again, experiencing negative emotions, learning how to deal with negative emotions responsibly, and then choosing to be happy in light of that is where happiness for me can be found.
You're exactly right. I think that's a really good mentality to keep in mind as people progress through challenges. And largely, tell me if you agree with this. You could argue, well, that the purpose of life isn't necessarily to be happy. The purpose of life is to find meaning. Would you say that happiness shouldn't be the goal that you strive for, but rather a byproduct of having the right goals?
I would say what you said is very close to the way I feel about it. And I would say the goal of life is to experience fulfillment, and fulfillment leads to happiness.
Yes. So rather than aiming for happiness itself, aiming for the meaningful goals that bring you personal fulfillment, and then happiness will be a byproduct of that.
Yep, correct. That's right. That's the way I think of it. Yeah.
Yeah, because I think we can get caught up in the pursuit of happiness, failing to realize that maybe that's not the right thing to put at the top of our hierarchy, because happiness can be experienced as a byproduct of those things. But now, tell us about how your experiences have changed the way you show up for your family. You're a father, you're a husband. What role did they play in facilitating your recovery and your subsequent growth?
Yeah, I would say I can answer this. Learning to be present has been a big part. And family life is probably the pinnacle in the area of my life that is most impacted by my learning to be present. Because, when I was active in my disease, and really for most of my life, I was either concentrating on the past and mistakes that I'd made, or the future. As other type A personalities, as physicians, we generally never dwell on our successes. I mean, I can't even remember most of my successes, but I remember all of my failures, and I dwell on all of my failures. And so learning not to be concentrating on the past or the future, because the present time is the only thing that we have control over. That's easier said than done then. And so for me, at least, it was. And so learning to live in the present, it's been most rewarding with time spent with my family.
Hmm. Beautiful. And isn't it interesting? Humans are so much more sensitive to negative experience than we are to positive. Like you said, you forgot nearly all of the successes, but you definitely remember most of the negative experiences. If I was
Yep.
smarter, I would understand the evolutionary science behind that, but save that for another episode. Dr. Cordes, there's a lot of physicians, there's a lot of students, residents that may be listening, struggling with burnout, mental health, even some substance abuse, perhaps. What would be your message to them? What's the first step they could take towards healing, towards finding true fulfillment?
Yeah, well, the first thing I would say is to basically give yourself a break. Doctors and physicians and professionals at large, we're not really the ones to ask for help. We're not really the ones to admit that we can't do everything better than everyone else. I don't want to generalize here, so I'll speak for myself. That's certainly the way I felt about things. And so having some compassion for yourself, that you're not superhuman, that you are going to probably experience burnout. Almost everyone, at least once in their career. But again, the difference between working really, really hard and being burned out is when the joy disappears. And especially when that lack of joy melds into your personal life. And so there are resources available. It is a shame because a lot of doctors avoid getting help with mental health because they're afraid it's going to impact their professional reputation. And there is perhaps a little bit of truth to that. But there are a lot of resources that prioritize privacy that you can utilize. And in terms of coaching, you can find me at theburnoutdoc.com. There are physician coaches. They're not very many at this point. I think it's going to be a field that grows exponentially over the next 3 to 5 years. But there are physician coaches that can coach you out of burnout or to avoid burnout. And I wouldn't wait. Ideally, you don't wait until you're a 9 out of 10 on the burnout scale and you've already started to suffer consequences of burnout. Once you start seeing those early signs, med students, residents included, and any healthcare professional, any professional for that matter. But in terms of what I treat, as soon as you start to experience the early symptoms of burnout, it's time to start to look into coaching as part of your treatment. Obviously, you want to get evaluated by a professional mental health provider, psychiatrist, a psychologist, to make sure that there are no Axis 1 disorders. Yeah, get some coaching. It's extremely helpful.
Yeah, it's good to have a coach. It's good to have an external perspective. The person who quoted this escapes me right now, but maybe you would remember who said this. But the physician who treats himself has a fool for a patient. Have you heard that one?
Yeah, I don't know who said it, but yeah, I've heard that.
It was one of the classics, but it's exactly right. It can help to have an external perspective when you're feeling this way. Have some compassion for yourself, find some peace, and maybe get some external support. So, Dr. Cordes, my final question for you, sir. The mission of the physician's mind is to give successful people a platform to share their experiences and their advice for curious people and help them optimize their journey of lifelong learning and self-improvement in medicine and beyond. In line with his mission, do you have any final pieces of advice that you would like to share with the audience?
Sure. I would say, if you find yourself in a dark place, especially if it's from a mental health standpoint, um, it can be helpful to just do the next right thing. So a lot of times when we're in the depths of mental health darkness, a panic can develop and you feel like time is crunched and you're running out of time and whatnot. But just do the next right thing. And that might be get out of bed. That might be get out of bed and make your bed and eat breakfast. I mean, it can be as small and incremental as every 5 minutes, but just make sure you do the next right thing. And a lot of times, if you combine enough of those and string those together, you've turned a bad day into a good day.
Great advice. Yeah, even if you have to do something badly, it's better than doing nothing at all when you're experiencing those feelings. Well, Dr. Cordes, thank you so much, sir. If somebody wants to learn more about you, where can they find you?
Yep, theburnoutdoc.com. You can find me that's my website, and I'm on Facebook and Instagram and LinkedIn and most of the social media outlets.
Excellent. And for someone interested in picking up your book?
It's called Cancer is for Older People, and it's available on Amazon, Barnes & Noble, any major book outlet.
All right, you heard it here first, folks. Cancer is for Older People, theburnoutdoc.com. Dr. Brett Cordes, thank you for joining me today.
Absolutely, Curtis. Thanks for having me.